After we transfer the embryo, so the next step is the embryo implanting, really. So that is what should happen inside your womb. That implanting, as we discussed already, could be sometimes something that some people feel, and sometimes is not felt at all. Now and then, obviously, there is this those waiting time for the pregnancy test, and those 2 weeks or 10 days of wait, they're really difficult for the patients. And we know that it's terrible because. Basically, you've been up until the day of the embryo transfer, you've been very busy with lots of injections, lots of appointments, lots of phone calls, lots of bloods. So your life was all about that. And then suddenly, from the day of the embryo transfer, we kind of everything stops, and there are no more phone calls. There is no more blood taken. It's just the medications, obviously, to continue. But that period of time can, we understand patients can feel a bit alone and abandoned in a way. So it's very important to have support during that time, and to do things that you are happy in doing, even if that means online shopping or proper shopping, retail therapy, that always helps, or book an holiday or whatever. But just so just look after yourself during that time, because it can be quite difficult, really, after the moment after you have your embryo in, and you don't know whether it's implanting or not, whether it has implanted when you're pregnant or not. So it can be quite worrying as well. Any issues, any worry, is always better to discuss with your doctor or with a nurse or with a counselor. As I said, the clinic hasn't abandoned you. You're still a patient. So if there is any worry at all, it's better to get in touch and share your worries. But other than that, is just wait and see.